One of the big things about the student clinic at Chico Massage School is that this is to teach our students how to really be a professional and how to run a business, right? It's an actual clinic. The students are going to learn how to open the clinic, prepare for clients to come in. They're actually going to do some cleaning because if you rent your own studio space, there's a level of clean that you should keep it at so that it's professional. It meets the health and hygiene standards and regulations, sanitizing between clients. They're also going to have to learn time management. This is a big thing, right? So when you're setting your schedule and booking clients, depending on if you're working at a spa or for yourself, a lot of spas only leave 10 or 15 minutes between appointments. So our students are in there and we build them up to shorter times between so that they can learn how to manage time. And that includes when clients come in, doing the verbal assessment, if the client hasn't filled out their intake form in advance, getting comfortable asking strangers to walk or to move so that they can do the visual assessment and see if they can see any compensation patterns. And then our students get to actually practice making recommendations of based off of what your goals are. You said that you have this pain and you said that you've tried this before and it hasn't worked, or that before and it hasn't worked. I would like to try this on you. And this is why I want to try that and why I think it will work for you. And educating the clients on what is going to be most beneficial for them. And then taking them in and doing the session, doing the massage, incorporating their skill sets, and then also practicing the things they might be uncomfortable with. So the psoas is a very vulnerable, personal, and uncomfortable area to work. So we talk to our students about this, they experience what it's like, and we make sure that they get comfortable explaining this to the client so that the client understands what's happening and why. And so after, we spent the time learning the psoas, we're like, okay, who's ready to practice this in clinic? And some of them are just like, it'd have to be a clinic client I was comfortable with or that I knew. And I said to them that that's not okay, that they need to base that off of the assessment of what the client is saying, and they also simply need to practice it for themselves. If it's scary and it's uncomfortable, we want you to practice it here in school. That's what you're paying us for. And that when those students come in, or the clients come into clinic and they're paying $25 an hour for that massage or $45 an hour for that massage, it's a bargain and they're getting a lot of benefit. But it's about the student learning that skill set and getting comfortable. So we actually prep our students before clinic and we're like, okay, you're required to practice this because you're uncomfortable with it. And if you don't practice it, you'll lose it, and then you'll graduate from school and you'll have this tool that you were taught that you were too afraid to use, and then you'll have clients that will need it and you won't have that skill set. And our program is about making competent massage therapists. So sometimes you have to get a little uncomfortable and do the uncomfortable thing that you're not confident in until you do get competent. And then we also have an instructor supervising clinic the whole time, and you can pull them over anytime you need them, whether it's me or Aaron, and say, hey, maybe you're doing psoas work on a larger person and there wasn't an opportunity to practice on someone like that in class. So bring the instructor over. Or maybe you are going to practice psoas work on someone who has a hip replacement or something, and you're not sure if you can do that or not. That's what the instructor is there for. We want you in clinic to have the real life experience of working on a variety of bodies, using your assessment tools, and using the techniques you're learning to best benefit your clients. So by the time you graduate, when your clients are paying you $85 or $100 an hour, you're not uncomfortable doing what their body needs. You're comfortable assessing if they need psoas work. You're comfortable explaining it to them. You're confident in your ability to do the work safely and communicate with them and understand what the benefits are going to be. So that's really what our clinic is about, is it's very focused on our students, and the public get a wonderful benefit from our very talented students practicing the things that they're getting better at. And also, as they get better, they're getting really wonderful, lovely experiences as well. So, a little bit about our clinic.